20.8 million people have enrolled into an ACA plan in 2024, and that number is projected to stay consistent in 2025. However, there are some things that you need to know about the ACA. I have created a presentation for you to go over the basics from beginning to end, as well as dropping some tidbits of what you can expect coming up here in the future. Hello and welcome. My name is Evan, broker Pollard. I am licensed in life, health, accident, and sickness. If at any point you find the information that I presented helpful, please give this video a like, comment, and share if you care. If you see on my channel, I have already done a Medicare 101 presentation where I went over the roots of Medicare with you. And I have also gone over the fact that ACA rates are going up for 2025 and more. As I mentioned, I created an ACA 101 video for you guys to discuss the Affordable Care Act and all of what is comprised within it. In this video, we will briefly discuss the history of the Affordable Care Act and its origination, the coverage that is provided on these plans and the type of coverage you can receive, who is eligible for an ACA plan, and if you're looking for financial assistance, how to become eligible for that as well. We will go over the financial responsibility. Next will be ways to enroll, when to enroll, and what you can expect post enrollment. And lastly, we will briefly cover some tax information before getting into my services to you. The origination of the ACA. The Affordable Care Act is a reformation of the healthcare law. It was referred to in the news as the Obamacare Act, named after the president in office at the time. The Affordable Care Act's history timeline starts with its three goals. Those are affordability, medical care that is innovative, and the expansion of Medicaid. This is a chart presenting the federal law market rules for private health insurance sold to individuals and groups. The market rules in this table apply to fully insured plans sold to individuals and groups. Self funded employer plans don't buy insurance, but the rules related to non discrimination and pre existing condition exclusions still apply to those plans as well. Now, you'll see an asterisk under guaranteed issue. States could have stronger laws, and many of them did. Previously, insurance companies could deny non group coverage to people based on their health status or their medical expenses from the previous year. Before the ACA, insurers were required to guarantee issue certain policies and were prohibited from imposing pre existing exclusions only for a select group of HIPAA eligible individuals and met other requirements. Under HIPAA, states had the flexibility to use alternative mechanisms to provide guarantee issue, no pre existing coverage to eligible individuals, and nearly all did so. Here is a timeline of changes that happened to the ACA over time. In 2012, Community Living Assistance Services and Supports was established to provide basic long term care to Americans in need. Previously, in 2014, there was an individual mandate that required everyone to maintain health insurance coverage throughout the year. American citizens and U.S. residents without qualifying health coverage had to pay a tax penalty of the greater of $695 per year, up to a maximum of $2,085 or 2.5% of the household income. And that was set to increase annually based on the cost of living adjustment. In 2019, the individual mandate penalty was reduced down to $0 so that individuals without coverage no longer receive that tax penalty for not being covered. In 2021, the American Rescue Plan Act, also known as ARPA, extended eligibility for health insurance subsidies to those on unemployment insurance and those making between 100% and 400% of the national poverty level. Originally, in 2013, family members were ineligible for financial assistance if the employee's individual coverage was affordable, even if the family coverage was unaffordable. In 2023, the ACA's family glitch went into effect. That came after the finalization of a new IRS rule in October of 2022. This family glitch has affected an upwards of 5 million people. This resolution allows many families the ability to benefit from a special enrollment period throughout the year. Now, I know we're not there yet, but there are some changes coming for 2025. The Congressional Budget Office, also known as CBO, expects the number of people with subsidized marketplace coverage to continue to grow throughout 2025, but then drop after the Inflation Reduction Act subsidies expire at the end of the year. If these subsidies are allowed to expire, people purchasing subsidized coverage will face significant increases in their monthly premium payments, and some may become outpriced by the market altogether. What is covered under the ACA? All plans offered in the marketplace cover these 10 essential health benefits: ambulatory services, emergency services, hospitalization, pregnancy, maternity, and newborn care, pediatric services, preventative wellness and chronic management, prescription drugs, laboratory services, habilitative services and devices, as well as mental health and substance use disorders. Plans must also include the following benefits like birth control and breastfeeding coverage. They may also include some additional benefits like dental, vision, and medical management, more specifically for weight management, back pain, and diabetes. So be sure to compare these plans to know exactly what you are enrolling in. Essential health benefits are minimum requirements for all marketplace plans. Specific services covered in each broad benefit category can vary based on your state's requirements. If you're pregnant when you apply, an insurance plan cannot reject you nor charge you more because of your pregnancy. Once you're enrolled, your pregnancy and childbirth are covered from the day your plan starts. If you give birth or adopt after enrolling in your marketplace plan for the year, your child's birth or adoption qualifies you for a special enrollment period. This means you can enroll in or change plans outside the annual open enrollment period. Your coverage can start from the date of birth or adoption, even if you enroll up to 60 days afterward. So be sure to prepare yourself accordingly so that you know exactly what your costs and responsibilities are when you're ready to give birth to your child. There are some exceptions, which would be grandfathered plans. They don't have to cover pre existing conditions, nor do they have to cover any preventative care. If you have a grandfathered plan and you want pre existing conditions covered, you can either switch to a marketplace plan that will cover them during open enrollment, or you would have to use a special enrollment to enroll into a new marketplace plan once your grandfathered plan year ends. There are a few things that the ACA prohibits health plans to do, which we briefly went over on those charts earlier in the presentation. The ACA prohibits healthcare plans from denying people coverage, charging them higher premiums, as well as rescinding or imposing exclusions due to pre existing health conditions. Those with pre existing health conditions cannot be charged higher premiums, nor can health insurers charge more based on gender or other factors. ACA compliant health plans can only vary premiums based on location, family size, tobacco use, and age, with older adults being charged no more than 3 times the amount of younger adults. Types of plans to choose from. There are 5 types of plans offered on the marketplace. The 4 main categories are known as metal tiers. Generally, the difference between these categories is based on the cost sharing amount between you and the plan. All marketplace plans in every category must cover the same 10 essential health benefits, including preventative services. Many plans also offer programs to help manage chronic diseases and health conditions before you meet your deductible. If you qualify for a premium tax credit, you can get lower premium costs in any of the 4 metal tiers. So that excludes the catastrophic tier. And also, the name of the plan has no correlation to its quality of care either. Catastrophic health plans have low monthly premiums but very high deductibles. They are also available to people under the age of 30. And just like its name, this is for worst case scenario coverage, like if you get seriously sick or injured. However, if you do qualify for financial assistance, a bronze or silver plan may be of better value. So be sure to compare. Bronze plans usually have the lowest monthly premiums, but the highest cost when you get care. You could have to pay thousands of dollars for healthcare costs yourself before your plan starts to pay its share. Just like the catastrophic plan, it could be a good choice for you if you just want coverage for when you become seriously sick or injured. On a bronze plan, the plan pays 60% while you are responsible for paying 40%. Silver plans fall about in the middle. You'll pay a moderate monthly premium and moderate costs when you receive care. If you qualify for cost sharing reductions, you must get a silver plan in order to utilize those benefits, which will drastically decrease the amount that you pay for the deductible, co-payments, and co-insurance. On a silver plan, the plan pays 70% while you will pay 30%. Gold plans usually have higher monthly premiums, but lower costs when you receive care. Gold may be a good choice if you use a lot of medical services or would rather pay more upfront, knowing that you'll pay less when you receive your care. On a gold plan, the plan pays 80% while you pay 20%. The last metal tier is a platinum tier. Platinum plans usually have the highest monthly premiums of any plan category, but pay the most when you get medical care. Platinum plans may work well if you expect to receive a great deal of medical care and would rather pay a higher premium upfront, knowing that nearly all of your medical costs are going to be covered. On a platinum plan, the plan pays 90% while you're responsible for 10%. There are different types of marketplace health insurance plans designed to meet different needs. Some plans restrict your provider choices or encourage you to get care from the plan's network of doctors, hospitals, pharmacies, and other medical service providers. Others pay a greater share of costs for providers outside of the plan's network. Depending on how many plans are offered in your area, you may find plans of all of these types at each metal level. Health maintenance organizations, also known as an HMO, is a type of health insurance plan that usually limits coverage to care from doctors who work for or contract with the HMO. It generally won't cover out of network care except in the case of an emergency. An HMO may require you to live or work in its service area to be eligible for coverage. HMOs often provide integrated care and focus on prevention and wellness. The goal of HMOs is to align financial and care quality incentives. A PPO, also known as a preferred provider organization, is a type of health plan where you pay less if you use providers in the plan's network. You can use doctors, hospitals, and providers outside of the network without a referral or an additional cost. That percentage you pay varies by plan and is outlined in your summary of benefits. Some plans may require you to get a referral from your primary care provider to see a specialist, but most don't. You may also need pre approvals for some medical services, especially if you don't have a primary care provider. The next one we have is a point of service, which is also known as POS. That is a type of plan where you pay less if you use the doctors, hospitals, and other healthcare providers that belong to the plan's network. POS plans require you to get a referral from your primary care doctor in order to see a specialist. A point of service plan may be a good option for you if you want lower premiums and copays, don't need specialized care, and are comfortable coordinating your care with your primary care provider. Exclusive provider organizations, also known as EPOs, is a managed care plan where services are covered only if you use doctors, specialists, or hospitals within the plan's network. Of course, again, except in the case of an emergency. EPOs are a good fit for people who want the flexibility to choose their providers without needing a referral, but are comfortable staying within the EPO's network. Who is eligible for the ACA? To be eligible for the ACA, you must be a U.S. citizen or national and lawfully present in the United States. These plans are available to people who are under the age of 65, and individuals may remain on their parents' plan up until the age of 26. Once you surpass that age, you must receive and enroll into your own plan. However, you must not be incarcerated, covered by any other plan like Medicare or Medicaid, and if you are married, you must file your taxes jointly. It is important to know some things if you do have Medicare and you are interested in the marketplace. It is against the law for somebody to enroll you in a marketplace plan when they know you have Medicare, even if it's only Part A or Part B. However, there are a few situations in which you may enroll in a marketplace plan. The first is if you would have to pay a Part A hospital insurance plan premium. And you would typically have to pay that if you did not work your 40 quarters, which is 10 years. Another instance is if you haven't signed up for Medicare and you have a qualifying medical condition or illness like end stage renal disease. And lastly, you just simply haven't started collecting your Social Security benefits when you become eligible for Medicare. Before choosing a marketplace plan over Medicare, there are two important things to consider. If you want to sign up for Medicare after you're first eligible, you may have to wait until the general enrollment period, which runs from January 1st to March 31st of every year. This means you'll have to go months without medical coverage. In most cases, you'll also have to pay a monthly late enrollment penalty, and that penalty is added to your monthly premiums, and it goes up the longer you wait. And in most cases, if you have a marketplace plan when you're first eligible for Medicare, you'll want to end your marketplace coverage. If there are other people on your marketplace application, you can end just your coverage, which is you, the person getting Medicare. But don't end your marketplace plan until you know your Medicare coverage starts. Once you end the marketplace coverage, you cannot re enroll until the next annual open enrollment period. What will my financial responsibility be? When picking a marketplace plan, it's important to compare your estimated total yearly cost for each plan, not just the premium. The cost when you get care can have a substantial impact on your budget. The total yearly costs include the monthly premium, deductibles, co-payments, and co-insurance, as well as your out-of-pocket maximum. For best practices, estimate your anticipated use of coverage for the year to draw a more accurate conclusion of your household costs. And don't forget to include your prescription drug costs as well. The first type of premium subsidy is called the premium tax credit. It reduces enrollees' monthly premium payments for insurance coverage. Premium tax credits can be applied to marketplace plans in any of the four metal levels of coverage. The second form of financial assistance available to marketplace enrollees is a cost sharing reduction. Cost sharing reductions lower enrollees' out of pocket costs due to deductibles, co-payments, and co-insurance when they utilize covered healthcare services. People who are eligible to receive a premium tax credit and have household incomes from 100 to 250% of the federal poverty level are eligible for cost sharing reductions. A premium tax credit works by limiting the amount an individual must contribute toward the premium for the benchmark plan, also known as the second lowest cost silver plan, available to the individual in their marketplace. In 2024, for individuals with income up to 150% of the federal poverty level, the required contribution is zero. While at an income of 400% of the federal poverty level or above, the required contribution is 8.5% of the household income. Unlike the premium tax credit, which can be applied toward any metal level of coverage, cost sharing reductions are offered only through the silver plans. The ACA requires maximum annual out of pocket spending limits on cost sharing under marketplace plans, with reduced limits for cost sharing reduction plans. In 2024, the maximum out of pocket limit for an individual is $9,450 and $18,900 for a family on all qualified health plans. The most generous cost sharing reductions are available for people with income between 100 and 150% of the federal poverty level. Silver plans with the most generous level of cost sharing reductions are sometimes referenced as CSR 94 Silver plans. These plans have a 94% actuarial value, which represents the average share of health spending paid by the health plan. Somewhat less generous cost sharing reductions are available for people with income greater than 150 and up to 200% federal poverty level. These reduce cost sharing under silver plans to 87% of the actuarial value. For people with income greater than 200% and up to 250% of the federal poverty level, cost sharing reductions are available to modestly reduce deductibles and copays to 73% actuarial value, also known as the CSR 73 plans. To qualify for financial assistance through the Affordable Care Act, you must meet certain requirements, including having an income between 100 and 400% of the federal poverty level, not be eligible for any other coverage, such as Medicaid and Medicare. You cannot be claimed as a dependent on any other person's tax returns. And if you are married, again, you must file taxes jointly. The first step to seeing if you qualify for financial assistance would be to estimate your household's adjusted gross income. If you don't have your most recent AGI, there are other ways to estimate your income. You can add any of the following kinds of income as the list follows. You may add federal taxable wages from your job, self employment income, rental and royalty income, investment income, capital gain, foreign income, retirement or pension income, Social Security disability income, unemployment compensation, alimony that was finalized before January 1st of 2019, as well as tips. The third step to estimate your expected income would be to adjust the estimate for any changes you may expect. Please consider the following for your household, which would be expected raises, new jobs or other employment changes like a change to your schedule or self employment income, changes to your income from other sources like Social Security or investments, as well as changes in your household like gaining or losing dependents. Gaining or losing dependents can have a drastic impact on your savings. We estimated expected income. Now let's estimate unexpected income, one of which can be from self employment income. You can enroll through a marketplace plan if you are a freelancer, consultant, independent contractor, or any other self employed worker who doesn't have any employees. If your business has even one employee, you may be able to use the shop marketplace for small businesses to offer coverage to yourself and your employees, even if that employee is a spouse or family member. It is important to update your estimated annual net income when your business circumstances change. If you wind up making more than you reported on your marketplace application, you may have to pay back some or all of the premium tax credits you took during the year. If you wind up making less, you could qualify for more savings than you claimed during the year. The income you will enter on your application will be what you will file on your Schedule C for your federal tax return. Remember to list your income properly, whether it is a net income or a net loss based on your business expenses to revenue. More on unexpected income. If you are unemployed, you have a couple of options to choose from in order to obtain coverage. One option is to place an application through the health insurance marketplace. You'll receive a determination letter directly after the application that will notify you of any eligible coverage. If it states that you are deemed eligible for your state's Medicaid program, you may apply for a plan through that program. However, if your assets exceed your state's limit, you may not qualify and would need to reapply for the marketplace coverage and insert in your Medicaid date of denial to explore plan options with a possible subsidy. Your second option would be to enroll in COBRA if continuation of employer coverage is offered. If you choose COBRA, you will be responsible for 100% of the premium. If you don't qualify for the premium tax credit on the marketplace because your income is too high, you can still apply and receive coverage anyway. You also have other options. You can get insurance through a private insurance company, an online insurance seller, or through an agent or broker. Who to include in your household? Marketplace savings are based on expected income for all household members, not just the ones who need insurance. Even if an individual in your household is receiving coverage through their employer or a plan they bought themselves, include them and their expected income on the application. And when you apply, you can select which household members need coverage. This chart explains who you should and should not include on your marketplace application. If you are single and you are not claimed as a dependent and you don't have any dependents yourself, count only yourself within your household. If you do have dependents, this chart explains to you when you should and should not include them. Some dependents' income may not be counted if they're not required to file a tax return, but include their income anyway. Your application will automatically exclude their income if they are not required to file. This chart continues on to explain who you should and should not include on your marketplace application. Please pause the video at any time to review the information. If you are married and will file separately for the year you want coverage, you can enroll in a marketplace plan together, but you will not be eligible for a premium tax credit or other savings, and you may have to complete a separate application. If you're living apart from your spouse and are a victim and want to enroll in your own health plan separate from your abandoner, you can say that you're unmarried on your marketplace application without fear of penalty for misstating your marital status. This will let you and possibly your dependents qualify for premium tax credits and other savings based on your income. There are different ways to apply for a health insurance plan through the marketplace. The first and quickest way to apply is online at healthcare.gov. You may also call the phone number listed on the screen to reach a call center representative. You may receive help in other languages. The next way is to go to healthcare.gov and select the button that says Find Local Help. There you can find agents like me. You will be able to find someone who may also offer in person services as well as assistance in other languages. You can also use a certified enrollment partner. They are not licensed like agents and brokers are and cannot make plan recommendations for you, but they are useful if you do have or need assistance in enrolling in an application, and they can answer any questions you may have along the way. The last way to enroll is going to be by requesting a paper application that you will fill in by hand and send that back in the mail. Here is one more way that you can get enrolled. As I mentioned, the quickest and easiest way to enroll is to go online. You can go to healthcare.gov, but I also have my own URL that you can visit. That URL is with Health Sherpa. Health Sherpa is the ACA's #1 quoting and enrollment platform that is fully integrated and automatically synced with healthcare.gov. It allows people to find, compare, and enroll in health insurance plans. If you would like to visit my Health Sherpa and get quoted and enrolled with me as your designated broker, you can find that in the QR code listed in the intro and outro of my video, as well as it being pinned down in the comment section below. And I will also always have that link in the description. Enrollment periods. There are specific times that you can enroll into a health insurance plan throughout the year. The main time of the year to enroll is the annual open enrollment period, which we are coming up on right now. So that begins on November 1st and ends on December 15th if you would like a start date of January 1st. If you enroll after the 15th of December, you have until the 15th of January to enroll with a start date of February 1st. Special enrollment periods are your chance to make changes to your health insurance coverage outside of the open enrollment period when certain life events occur. There is a continuous enrollment opportunity for the Medicaid and CHIP program throughout the year. Here are some instances in which you may qualify for a special enrollment period. You may have changes in your household size, like marriage, divorce, welcoming life, or departing from it. Secondly, changes in your residence, which occurs most often. In order to utilize the moving special enrollment period, you must be able to prove that you had qualifying health coverage for one or more days, 60 days prior to your move. Other life changes may include the loss or gain of health coverage within the household. Subsequently, we have the less common qualifiers for a special enrollment period, which would be gaining membership in a federally recognized tribe, becoming a U.S. citizen, leaving incarceration, or starting or ending service as an AmeriCorps state and national, VISTA, or NCCC member. Post enrollment. After you've completed your application, selected a plan, and enrolled, the last step would be to pay your premium to effectuate your policy. You will pay your premium directly to the insurance company and not the marketplace. You will receive plan materials and a health insurance card in the mail post enrollment. If you do not receive your correspondence, call your insurer to ensure your coverage is active. You don't want to miss a premium payment, but if you do, here's what you need to know. I'm sure you're aware, but if you stop paying, your coverage will end. Before it does, you have a short period of time to pay. The length of your grace period may be different if you don't use the premium tax credit. So please contact your state department of insurance for information on grace periods in your state. But if you do use a premium tax credit, the grace period for health insurance premium payments is usually 3 months if both of the following are true. You have a marketplace plan and you receive a premium tax credit, and you've paid at least one full month's premium during the benefit year. If you miss your premium payment, you will enter the 3 month grace period, which starts the first month you did not pay. And you will need to pay all of the premiums owed in order to keep your plan. Unfortunately, if you let your plan terminate due to non-payment, it will not qualify you for a special enrollment period. And if you lose your coverage before mid-December, you will not be automatically re-enrolled for the new year. However, that will land you within the annual open enrollment period, which you can just place a new application and obtain coverage anyway. But still, please don't miss your premium payments. And please don't term 1095A form, and tax information. Form 1095A gives you information about the amount of advanced premium tax credit you received during the previous year. A copy of this form is also reported to the IRS, so please keep it for your records. The advanced premium tax credit you received was based on the annual income you estimated you would earn when you signed up for marketplace coverage. Now you must file a federal income tax return to compute your actual income for coverage that year. If your actual income was lower than what you estimated, you can claim the difference as a refund when you file your tax return. If your income was higher than you estimated, you might have to pay back some or all of the difference when you file your return. If anyone in your household had a marketplace plan the previous year, you should get a Form 1095A by mail no later than mid February. It may also be available in your marketplace account anytime from mid January to February 1st. Please make sure that it's correct. Carefully read the instructions on the back, confirm the accuracy of the household size and coverage, and also confirm the second lowest cost silver plan amount. How to know if your second lowest cost silver plan information is correct. You'll take a look at part 3, column B of your 1095A, titled Monthly Second Lowest Cost Silver Plan Premium. It should show figures for each month any household member had the marketplace plan. The second lowest cost silver plan premium will show up incorrect or be incorrect if part 3, column B has a zero or blank for any month someone in your household had the marketplace coverage, and or if you had changes in your household that you didn't tell the marketplace about. If either one applies to you, use the tax tool on healthcare.gov to get the premium for your second lowest cost silver plan. If any of the information is incorrect on your 1095A form, please contact the Marketplace call center and do not file your taxes until you have a corrected form. My services to you. I'm sure you figured it out by now. I am here to serve you. I am an insurance broker that is contracted with a number of companies to offer you options for coverage. I offer a range of products to provide you a peace of mind when it comes to the health and financial security of you and your loved ones. I'm here to assist you through every step of the way. I provide no cost services to you prior to, during, and post enrollment as your designated broker. Give me a call at the number on the screen today or scan the QR code so that you can get started yourself online. I look forward to speaking to you and or a loved one, and I thank you so much for tuning in to my presentation of the Affordable Care Act 101. Again, if you found any information in this video helpful, please give it a like, comment, and share if you care, and hopefully you've subscribed. And again, open enrollment begins on November 1st to January 15th. So utilize Health Sherpa to get quoted and enrolled with me today.